Human Resources Presentation. Now, to start off with the introduction, this presentation will be providing an analysed and the data from GP nurses, also known as general practitioner nurses. The main point will be covered will be job descriptions, so what that job entails and what they have to do to perform their job. The personal specifications is what they specifically need and what they want to be able to, for them to perform their job. And also the qualifications, so from schooling, from nursing, from doing bank shifts and things like that. Now moving on to the contents page. This is what will be covered. Now I'm going to talk a little bit first about the history. Now, we all know a little bit about the history of nursing, as famously known as Florence Nightingale. Now, she is one of the most influential people in the world of nursing. She continued to show people how to care for patients, how to look after people, because she had a real passion for it, which is absolutely fantastic, is what you actually need for nursing. And because of her, the first school opened, and that was around about 1860. Now, she has left long contributions, obviously, like the school, and obviously how they look after patients and take care of them. Now moving on to what is a nurse. Now we're going to talk about first about a nurse in general aspects, because a nurse is not just, yes, they look after sick people. They all have their each own sections and specific areas in which they need to obviously perform their job, depending on what job title they have. Obviously they range from different, it depends, it really depends on which area they want to go into, whether it is being a healthcare assistant in a hospital, or obviously speaking about this presentation today is obviously based on GP nurses. So obviously if they wanted to be a GP nurse or a physician or anything like that. Speaking on broader terms, it's neither a woman or a man, it's both. Before, back in the day, it was women. Men nurses were seen as something that shouldn't happen. But nowadays, thanks to Florence Nightingale, and thanks to different laws and things changing, being the 21st century, we are able to see now that nurses are not strictly just for men or for women. And obviously they will be trained in a university and take further training if they wish to become a physician or whatever they want. Nursing includes several fields. So they sometimes cover prescriptions, diseases, monitoring people, caring for the elderly, looking after the blind or people that can't hear. It's not just one thing. Now we're going to move on to the next slide and get more specific. Places of nurse. So places of a nurse will either be in a clinic or a hospital. They could be in long-time faculties, military, physicians, private home, care homes, all sorts. There's no actual limit from where nurses are meant to be. And some even go into the insurance side and do all of that side. Now we're going to look at job analysis. Here are 4 main points of a GP nurse. GP nurse, short for general practitioner. So, a GP nurse, what is a GP nurse? A GP nurse is somebody that works in a faculty of 5 or 6, depending how big the area is. And that is the main one of the main aspects of being a GP nurse, because you have to be able to work in a small building, a big building with a team. That is a prime thing that you need. Now we need patient care. Obviously that's the most second important thing. Obviously you will hear a lot in the newspaper or on websites or in books, and it will tell you patient care is number one. That comes first, which is true. Patient care should always come first. And that is another big aspect when analysing a GP nurse. Loyalty. Now, this doesn't cover as in speaking to them and being loyal to them. This comes for patient confidentiality. They need that bond between them, but they can't get too personal. And from the job, that is another main point that they need. They need to be loyal, not just to their patients, but actually the other people they're working with, because they need these people to say, you know, if they can't get a prescription or they're in trouble, they need that loyalty and that stability to be able to go to another person and say they need this and they need that. Now, professionalism. That's another key point that they need. From looking at this job, they need professionalism. They can't walk around into it and all slumped and like, oh, you know, they've got to be presentable, not just physically, mentally. They have got to be professional at all times. If someone comes in and says, oh, I slipped over a banana, for instance, they can't then laugh. They've got to maintain that professionalism. They have to have this professionalism to be able to maintain not to make themselves look good, but to the patients as well, because the patients need to establish a trust. And if the patients don't trust them because they're not being professional, they're not going to come back to that GP. So they need to maintain it, not just for the patients, but obviously for the name of the GP, the name of the actual surgery that they work at. It cannot be, it can't be just, you know, yo, what's up, you know, that sort of thing. They've got to maintain a professional look about them, physically and mentally. Now we're going to move on to job description. Now the job that GP nurses are doing. GP nurses work in a GP surgery, as I said before, as part of a healthcare team. Like I said, that's a big part of it. That is the main thing. You come to a GP, you ring up, you book an appointment, and you tend to not see the same doctor or nurse twice, which is true. Because obviously they need to rotate and, you know, build up that thing. Sometimes they ask specifically to, you know, a patient will say, I want this person, which is fine. There's nothing wrong with that. But primarily, they need to be able to work in a team to be able to do this job. Otherwise, if they can't work in a team, they can't do it. So it makes no sense for them to be in this profession. Now, general practitioner nurses may also have a direct supervision of healthcare assistants at the practice. So what this is saying is they have, excuse me, they have access to this. They have access to healthcare at their GP service. They tend to be involved in patients by taking blood tests, wounds, child's injections, pregnancy tests, family planning, consultations, you know, minor wounds, big wounds, but then they tend to send them to the hospital if that's the case. But generally that is their job. And obviously what I haven't also put on that, which I'll talk a bit more about, because obviously as you can see I ran out a little bit of space. I see you've got these main valid points which the job actually describes and what they do. What also we haven't seen here is that nurses, GP nurses obviously, they don't just work in a team, they don't just take blood, they also do prescriptions. Prescriptions are a big part of it, and they also have to be computer literate. That is a need for them. They need to be able to get on the database to be able to see the history of that person's whatever's been previous problems. That's what they need. Now next we're going to move on to personal specifications. Now this is specifically what an employer for employing a GP nurse will ask for. They will ask for, they have to be organised. Of course we all know what organisation is. They need to be organised with their times, the dates, getting there on time, things like that. Versatility, verbal communication, compassion, professional relationship, intelligence and people management. Now, as you can see throughout these slides, there is a repetition of certain words. Professional relationship is another one. Communication and organisation. They're all things that they just not need, they want as well, because sometimes they lack in that area. Moving on to the next slide, we have required qualifications. Now, to do this job, and what the employer needs is, obviously you've got to complete school. So primary school to secondary school, you must have completed that, and completed that with at least 5 C's. Now you will train at a university. Now the levels of that is pretty much the same, a 1-1, a 2-2, all of that. They need the minimum of a 2-2 to pass and be able to be a GP nurse. But they wouldn't then be able to train for another 3 or 4 years to be, say, if they wanted to go higher, like a matron in the GP. So more responsibilities they couldn't, because they'd have to go for further training due to the lack of university qualifications. Now, saying that they have done it, they require working in a team, again repeated, because it's such an important element. They need good computer skills, as I said before. They need the database, things like that. They need to be able to type in prescriptions. They need to be able to, you know, spell, read, write, and be able to the next doctor can, or GP nurse can see what they're putting. Dealing with emotional situations. Now that is required. It's under qualifications. I was a bit skeptical at first, but it is a qualification that you need. Not one that is physically on paper, but you need to deal with emotional situations. If you're an emotional wreck, how are you supposed to deal with somebody, say, oh, to say that, say for example, a dog died, and they can't control themselves? That's not good, and that's not very, you know, professional. So they've got to be able to deal with emotional situations and not try to get too attached. They've still got to have that level and that balance of being a nurse, well, a GP nurse, and obviously observation skills, to be able to pick up things and have the initiative and, you know, using that sort of skills. Now we're going to move on to wanted skills. They want people that are flexible, adaptable. They want people who can be organised, confident, use their own initiative, excellent people skills, answer questions and offer advice, happy to be part of a team, dealing with emotional situations again. So it's not just a want, it's a need. And like I said, a lot of these are repeated because they're not just a need, they're a want as well. It's something that they want. The more that you have, the better chance you have at completing this job with no problems. Obviously there will be problems in the way, but they'll be less likely to have any problems if they continue to have all the wants and the qualifications that they need. Now to move into incentives. Now, what makes people want to do this job? 5 weeks paid holiday. I must say myself, I would love that if that happened to me. That would be fantastic. Sometimes it depends. If this is full-time, but if you're part-time, that is to be negotiated. So sometimes a GP will offer them